Becoming a registered nurse is something I've been working towards for the last 3.5 years. Working as a nurse assistant has helped me to discover that helping others is something I truly enjoy. During the last 12 years as a CNA, I have seen how important communication is in the daily life of a nurse. Patients put their lives in your hands and depend on you to make precise and accurate decisions. Communication is clearly the key to making this happen. This is why the 3 most important communication tools for nursing would be listening, interpersonal communication, and nonverbal communication. All of these are key factors in becoming a good nurse. The first step in effective communication is listening. To fully understand the needs of your patient, you must first know what's wrong with them. Taking the time to listen to them also helps develop trust between the two of you. According to the article, Communication in Nursing, Lynette Anderson states, if they don't trust us, any communication that we attempt to send to them may be disregarded. To help gain trust, a patient must feel confident that you are going to hear what they are saying and take the steps to fulfill the request they are making. While listening to the patient, it is important that you repeat back to them what they have said. This shows that you understand exactly what they are saying and helps to clear up any misunderstandings in the communication. It is also important not to interrupt a patient while he or she is talking. Letting them finish their thoughts helps to keep them from losing track of what they were saying and shows you have respect for their concerns. Listening is also important when getting report from another nurse and receiving orders from the doctor. Understanding what has happened during the previous shifts helps to keep you up to date with what is going on with each of your patients. When you are getting report or talking to the doctor, taking notes can be helpful to recall the things that were discussed. It is especially important when getting medication orders that you pay close attention to what the doctor is ordering. Messing up medications could have serious results and put a patient's life in jeopardy. Interpersonal skills are the next step in communication in the nursing field. As a nurse, you interact with lots of different people and pass on vital information about what has been happening. Usually in the nursing field, you and your coworkers have the same goal: to give the patient the best quality care you can give. In order to do that, you must work together to build care plans, develop medication schedules, and meet the patient's needs with efficiency. Working together also shows your patients that they can depend not only on you, but everyone that provides care for them. Another important aspect of interpersonal communication involves the patient directly. According to the Techniques of Communication in Nursing on Buzzle.com, introducing yourself and using the patient's name gets their attention and adds a personal touch. This site also says it adds a comfort level to the interaction and lays the foundation for a good rapport. Giving your undivided attention to the patient and asking open-ended questions shows them you are interested in meeting their needs. Asking questions also helps the patient to open up and gain trust with the nurse. This helps to form relationships, making the patient feel confident that you are going to give them the best care possible. Being comfortable with people who care for you is very important. Putting your life in someone else's hands is not an easy thing to do. So if a patient doesn't feel comfortable talking to their nurse, they may not share important information with them. The most important part of interpersonal communication is following through. If you tell a patient you're going to do something, you must do it. Get them the things they ask for or explain why you can't meet their request. If it's too early for a pain pill or you have run out of their favorite snack, tell them that. Be honest with them and follow through with the things you say you will do. This is the best way to show the patient that they can depend on you. Nonverbal communication is also important in this career. Sometimes our expressions say more than our words. Looking a patient in the eye when they are talking and not letting ourselves get distracted by other things that are going on around us helps to convey to the patient that they are your only concern. Nursing can get stressful and can be easily read if a nurse looks frazzled or seems in a hurry. Calming yourself down before entering a patient room can help to relax your facial expressions and clear your mind from some of the stress. Patients tend not to only worry about themselves, but also worry about you. So making sure you appear calm can relieve any extra worry they may have for you. Another aspect of nonverbal communication is that of a patient. They might tell you one thing, but their body language may tell you something different. Nancy Kimmel states that a nurse must always be aware of these expressions in clients, for these expressions may be the only way that the nurse can tell if something else is going on that needs their attention. A patient may say they are not in pain but grimaces when they move, or say they are not upset but have a concerned look on their face. It is a part of a nurse's job to get to know their patients and what their daily habits are. Knowing what is normal for each of your patient and what is out of character for them can help detect any onsetting problems. The nurse is one of the most important people a patient deals with. Having good communication skills is imperative in succeeding at your job. Listening, gaining trust, and meeting patients' needs are the best ways to make them feel comfortable with you. Knowing body language and asking the right questions gives you a better understanding of how a patient is feeling and what you can do to make things better for them. Being a nurse can be a very rewarding job, and knowing that you make a difference in someone else's life is the best part.